Nothing on the Bunnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bunnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Viatris and Genentech. Here's your host, Laura Bonnell.
As the Bunnell Foundation works to learn and educate about how people live with CF around the country, we're impressed by doctors who are making a difference with their CF patients without having the medications they need. We're talking with Dr. Haruthai Kamalaporn. Dr. Kamalaporn studied at SickKids Hospital in Canada and is now one of a handful of CF doctors in Thailand. She works specifically at a hospital in Bangkok. Dr. Kamalaporn would like to have more sweat chloride tests in Thailand. Some countries, such as India and Bangladesh, have developed their own indigenous method for doing a sweat test, and that's according to the information put out in part by the official Journal of Asian Pediatric Society in the Pediatric Respiratory and Critical Care magazine. There are 30 people in Thailand diagnosed with cystic fibrosis, and she has 12 of those patients. At this time, doctors in Thailand are not able to do a lung transplant when necessary. Dr. Kamalaporn believes that many more people in Thailand have CF. And Dr. Kamalaporn, it's so great to see you, even though we have a 12-hour time difference. I'm so glad that you could join us because it's so important to raise awareness about other people in our cystic fibrosis community so that everybody knows about everyone around the world. So thank you.
Thank you for your invitation.
There are about 30, that's 30 people right now that have been diagnosed with cystic fibrosis. Tell us, what the situation is in Thailand with the CF community.
Yeah, in Thailand, because of the difficult for the diagnosis, so we have only 3 centers that have the sweat chloride test. So if you are having some concern that you may have cystic fibrosis, it's very difficult for the parents to find the centers that can do the sweat chloride test. We have one private hospital that can have the sweat chloride test, which is quite expensive. Some of Thai people cannot afford that. And we have 2 government hospitals. Actually, one of that is my hospital, which is the University Hospital in Bangkok. All 3 centers are situated in Bangkok only. If you have the kids with you suspected to have CF, you have to bring them to Bangkok only. That's the situation with the difficult for the diagnosis. And another thing is very difficult to get the medication because it's not normal disease for Thai people. We believe that it might be only the disease for I'm sorry to say Caucasians or white people. So this is kind of mislead our situation a little bit, because if people think this is not the disease for our people, we find it very difficult to get a medicine because some of them have to be imported.
So interesting, the history of cystic fibrosis, and I guess how it started that was the belief. I guess it was just some kind of assumption that it was only white people, but thankfully everyone's trying to raise awareness that it can be everyone, maybe not to the same numbers, but we really don't even know. It could be the same numbers. It's just that we're only starting to test, right? And is it also part of the problem in Thailand that you still have to raise awareness? Because if you don't know about cystic fibrosis, you wouldn't even go get a sweat test. Is that correct?
Correct. That's the problem, because few people know about this disease. And if the doctor don't have any clues or any awareness of that, maybe they don't even know what the cystic fibrosis is. It's very difficult to know where to get the test done, because some of the doctors still they don't know that Thailand can do the sweat chloride test or even the genetic testing. Actually, we can do that, but we kind of wait for them to refer the cases to see us. But I think it could be better if we can raise some awareness. So if I find the case of cystic fibrosis, I usually contact the local doctors and send the patient back to them, because I would like more medical students to engage with the cystic fibrosis cases, and then they know how CF patients looks like and how to treat them, and how to they may help us to see the patient in the future, and then they may have some clues or some keywords, and then this case may be CF cases, and then send it back to us to giving the diagnosis. But in the future, if we can have more centers to do the sweat chloride test, to do the genetic testing, to have the CF medicine for all over the patients in the countries, that would be the best.
So is cystic fibrosis recognized in Thailand?
I'm not so sure, but we teach our medical students, we teach our residents and fellows to know what CF is. Right now, more and more doctors, respirologists or the chest doctors, we usually go abroad, go to study abroad. Some of us went to US, to Canada, to Europe, or Australia. So we know about CF better and better days by days. But the respirologists in Thailand, the pediatric respirologists, we have only maybe less than 100 doctors in the whole country. So that's why we still need more people to go abroad, to study abroad, and then engage with the CF patients and know how to treat it and how to raise some awareness. The budget is another problem, because if we have very few patients in Thailand, it's very difficult to get the funding or to get people give us the money for research, for medical access or the test, actually.
I want to get back to that, but I wanted to follow up with, so if I'm hearing you correctly, what you need to in Thailand is to raise awareness about cystic fibrosis so that more people are aware of the symptoms and get tested. But are your pediatricians looking for it more and recognizing that, people in Thailand and the Asian American community can in fact get cystic fibrosis or be born with a genetic disease?
Yeah, because years ago, some of the doctors believe that maybe only half blood of the Caucasian mixed with their Thai ancestor, and then they may have cystic fibrosis, but it's not true, because in our record, in our registry, we have 12 or 13 patients, and only one of them is half blood. Rather than that, it was the Thai people only. Or in the past case report from another hospital, we found that some of them are Indian or Chinese or some from Europe. Yeah.
So it can be an Asian person
Yes.
not having just married somebody from
Right.
America or something like that.
Right.
So how difficult is it to get medications if there isn't much recognition of the disease?
So right now, for the medication, in our institution, Ramathibodi Hospital, Mahidol University in Bangkok, we have hypertonic saline, we have salbutamol, we have the nebulization medication, but we don't have Toby. For Toby, we have to import it. And only one of my whole cases that can get Toby import, because the families are rich and then they can import the expensive medicine. But it's still difficult for the custom declare, because I have to make a letter, official letter to let them know that it is not the business thing. This is for this patient only, something like that. It's still getting the difficulty to bring the medicine, which is used for only small group of patients. And then for the others, we have colistin nebulization. I mean, the antibiotics. Yeah, we have only colistin. We don't have Toby in our countries. And for pulmozymes, we don't have it. And it's very difficult to bring the pulmozymes in.
Do you have albuterol?
We have it, but in our country, we use salbutamol. The different name, but the same medicine. Yes.
Oh, gotcha.
Yeah. We have azithromycin, but we don't have the Trikafta. We don't have any kind of genetic modification medicine. We don't have any.
And you don't have you don't even have consistent access to enzymes. Is that correct?
Yeah, the Creon. In our country, we call that Creon. For Creon, we have it in some of the hospital. Not every hospital have Creon. Some of my patients, we have to in personal contact with the local doctor to make it reimbursed from the government.
And then why do you think that Thailand is so far behind other countries? I mean, we know why in some countries, but is it just because it was seen as a Caucasian disease, or what's the reason?
I think one of the reasons is the misbelief that it is the white people's disease only. And the second is because the test is limited. It is still expensive if you go to the private hospital, which is only one private hospital in Thailand, the international hospital that have the sweat chloride test. And it's still kind of, some of them died since they were young and without any pathologist confirm that this may have some CF. So the infant died without any definite diagnosis. And then another child born with the recurrent pneumonia. And then if the doctors have some suspicions about CF, they have to find the knowledge or kind of what to do after that. Because usually if they find a recurrent pneumonia, they might think about immune deficiency disease, and then they might go to investigate for the blood test and anything else. But with the CF, if they don't do the sweat chloride or the genetic testing, they might be underdiagnosed. I would like to say that.
What is the average life expectancy for someone diagnosed with cystic fibrosis in Thailand?
For the other institution, I cannot say for them, but for my series of patients that I have, for 12 people right now, one of my patients died at 18, and the oldest patient that I have right now is 24.
Yeah, I would think that would be really hard for you to see them dying so young when you know, because, you just need more medications.
Actually, for the one who died at the age of 18 few years ago, actually he got bacterial. We list him for the first lung transplantation at my institution, but so sad that he couldn't wait. And he got BCPacia and then he died. It's very, very sad story.
Oh, that is very sad. And there's so much work that needs to be done in regard to BCPacia and phage therapy and other things to save patients like that. I guess, what are your hopes for the medications in Thailand, and what can the world do to help Thailand get just basic medications and vitamins and things like that you need?
Actually, my hope is I would like to have the CF Foundation in Thailand that we could gather the people who have CF and make some awareness, raise some awareness to the society, maybe. But because the parents of the CF patient, sometimes they don't want to expose their children to social, you know what I mean? Because they don't want people to look at the kids like the strange one, or some parents felt like, what did I do wrong? Is there any faults of me during pregnancy, something like that. So they some of them don't want to expose themselves. I did try a few times that, okay, can we just like raise up some awareness? Can I just interview them or making some video clips, something like that? But some of them kind of reluctant to do that because this is kind of the minority. They feel like they are the minority. And if they go to school, kids start coughing a lot. And then before the COVID-19 era, they feel like, oh, my kids look like a strange behavior that cough all the times. Maybe some of their friends afraid of him or afraid of her to get closer to be friends because they cough a lot, So it's very difficult.
So are they not going to school?
They go to school. And because they go to school, sometimes the respiratory care decrease from 2 or 3 times a day to once daily. And after that, they get sick and be kept in the hospital.
So you're saying they don't want it publicly out there,
right,
that their child has the disease because, okay, I understand.
Yeah.
What do you do not having all that you need to deal with cystic fibrosis patients? We both know Josh, who has talked to me. He is American. His wife is Thai, and he is part of CF Vest Worldwide, and his daughter has cystic fibrosis, and I know they came to America to get medications. What is your advice to patients? I mean, not everyone is able to do this, and it's kind of sad that they even have to, right?
Actually, of my patients, I check with their CF library, the gene library in Toronto, that if their genetic testing fit with the medicine, because as far as I know, not all CF can be treated with the Trikafta, right? There are some kind of specific set of gene or genetic tests that the medicine will work. But we check with the CF team in Toronto. I usually ask my teacher in Toronto that is this kind of genetic testing fit for this? But unfortunately, because Josh's daughter is the first case that have a Delta F508 mutation, which is fit with the Trikafta, right? But for the others, they have not.
They don't have that mutation.
Yeah, they have quite rare mutation, which is not fit with the medicine.
And because you studied at SickKids, so you have that
Yes.
great connection,
Yes.
so you can talk to your former, teachers
Yes.
and everything there. That's wonderful. But what are your hopes for Thailand as far as what you can get to, so you can better treat people with CF there?
I think the first start should be gather or have some CF registry in Thailand, gather them as a group, and then follow them. What do they need and what is their respiratory care they could access? Because some of the machine or even the nebulizer, the peri nebulizer, we have to have the personal contact for every single thing, which is quite difficult. And we have the great team. We have the great respiratory nurses. Some of them went with me to SickKids when I was studying my fellowship training in US. One of the nurses went to stay with me for a few months and learn about the respiratory care from SickKids as well. And with another center in Thailand, we try to teach them how to treat cystic fibrosis and how to get help. But maybe it's not enough. If we can have the screening, which I'm not sure that's going to happen in Thailand or not, because when you're asking for any budget or any machine, even the sweat chloride test in my institution, the question that always come back to me is, how many patients do you think gonna use your test per year, per month, something like that? If you think about the money or business, it's not worth it, right? But if you think this is the life of your CF kids, you think differently.
Absolutely. And I guess it sounds like they don't understand that you could have thousands of people that would test with cystic fibrosis if you had the equipment, right?
Right.
So where do you go from here? What are your efforts? I know I already asked the CF Foundation on your behalf to get a sweat chloride test, and hopefully we can do that. But is part of it getting the government in Thailand to accept that there are people with cystic fibrosis?
Actually, we have the group of the genetic doctors. They have set up about the rare disease, and CF is put in that rare disease in Thailand. I joined this group a few years ago, and they have the meeting or the conference every year. But I think maybe Josh is the only one parent from CF that joined the group, but it's not quite moving forward for CF. Actually, they usually move with their muscle diseases or another genetic diseases, Duchenne muscular dystrophy, something like that, which is much more patients in the group. So CF is kind of minority.
What is the average day for a person with cystic fibrosis in Thailand? They probably don't have a vest. Are they padding on, on their child's, back and side for lungs and everything?
Yeah. For the respiratory care, we have the PEP mask. We have the acapella, the vibrating PEP, we call acapella. And we don't have vests, but Josh helped us to get the vest for CF.
CFS yes. Worldwide, right?
Yes, right. Yeah, we are very thankful for that. We use the hand clapping, we use the huffing, breathing exercise, and kids use the acapella, PEP mask, bubble PEP. That's what we have. We have ultrasonic nebulizer.
Okay.
With the mist. Yep. And we have the peri nebulizer.
So, it's not where you want to be, but at least you have some of the medications. Is that correct?
Correct.
How do you feel being one of, how many CF doctors do you have?
It's very difficult to tell who is a CF doctors, but most of the doctors in recent years, they are graduated from abroad and they all know what CF is. But usually talking about CF, because they don't have the diagnostic test, so they usually send the patient to see us. But if the patients were sent from the university hospital, I send them back because of their potential after University Hospital, all of them can treat CF. I mean, similar potential. So, and we would like the many more doctors to engage with CF case, as I mentioned before. So I send them back. I just do the diagnostic test, send them back, and tell them if anything that we could help, just let us know. But for another hospital, which is the provincial hospital or the small hospital far away, we usually see the CF patients 3 or 4 times a year. And then after that, we just do the telemedicine. The respirologist, pediatric respirologist Thailand, right now we have almost 100, I guess, 100 doctors, but maybe the doctors that just recently graduated from abroad, maybe 20, I would guess so.
For the whole country, right?
Yes.
Moving forward, though, it is a slow movement. But what do you say to the parents of these kids who have CF? And, what are the stories? Do you feel very connected to them? Are you hopeful for their future?
Yeah, at my institution right now, we are planning for the lung transplantation. And I usually tell them that, okay, you have cystic fibrosis, which is not quite frequent seen in Thailand, but let's get hopeful because right now we have some medicine to preserve your lungs. And if you continue to do the respiratory care, got some vaccine and protect your child, they can go to school, they can have normal activities just like the other kids. And then if they get into teenagers, some of them might decrease the times to do the respiratory care, and that might have some infection quite more often. But if you try to preserve your kids' lung, one day in the future, they may find some more way to treat them. Right now, they have some medication for some specific kind of genes, but maybe in the future, they have some more widely treatment for the other kinds of genes. I would hope so. And for the lung transplantation, right now in our country, we are trying very hard to set up, but we may start with the lung transplantation with the patient without CF first. We might do in the kind of interstitial lung disease for adult first, and then after that, we're going to move to teenagers, just like in North America.
Have you done lung transplants for people with CF?
At my institution, not yet. We are getting on the start. We just do the heart transplantation for 4 or 5 cases successfully, and then we're going to move forward to do the lung transplantation, hopefully next year.
Okay, so the heart obviously is not for your CF patients, but I just wanted to end and wrap it up with what you see the situation being in Thailand with your cystic fibrosis patients and what you're hoping for.
Yes, I would hope that Thai people have some more awareness of CF in Thailand, that it could occur with Thai people without any half-blood, or it's not only the Caucasian disease. And I would like the doctors have some awareness that the kids might have some CF and send the patients to get the sweat chloride test done or genetic testing whatsoever. And I would hope for the future that many more centers in Thailand can have the diagnostic test and then can have the good quality of the respiratory care and treatment for cystic fibrosis.
Thank you so much, Dr. Kamalaporn, for doing this. It's going to help raise awareness, and hopefully you're going to get the sweat chloride test that you need.
Thank you.
Thank you. The original music in this podcast is performed by Kevin Allan,
It's not complicated.
who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Viatris and Genentech. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.